Hello, everyone. Welcome back to another in the series, Ask Dr. Ted. Today is February the 7th, 2023, and I'm Dr. Ted. And once again, welcome back. Today's topic is going to be a lot lighter topic than the last one. I did one on the sudden infant death syndrome, SIDS. That's just not an easy topic. It's kind of a heavy one, so I thought we'd do something more fun. First of all, I have an announcement, however. I just got back from the dentist. My whole family goes to this dentist. We've been seeing him for 20 years. The whole time we've lived here, we love him and his staff. They're amazing. I can't tell you his whole name. I don't want to do that. I'll just give you the initial of his last name. So this is a shout out to Dr. Z. First initial, and we love him, and he's a good man, and his staff is the best. So anyway, so back to our topic. Today's topic, when hiccups kill. And now you wouldn't think of that, right? Because everybody gets hiccups. Who doesn't get hiccups? I was talking to my wife, and she was saying, even when you're pregnant, your little baby gets hiccups. You can just feel them, and I thought it makes perfect sense. So here's the short answer to the question, can hiccups kill? No. But can things that cause hiccups kill? Yes. Is it common? No, thank heavens. When hiccups kill, it's kind of like when buying a lottery ticket makes you rich. It can happen, but it's so rare and so unusual that, you know the odds on that. And hiccups is a very, very common complaint. So I hope that got everybody's attention. So here's the thing. What causes hiccups? First of all, hiccups are caused by, it's kind of like your knee, right? When you're sitting on the table and they hit your knee and your leg kicks, right? It's kind of like your knee reflex. You hit it, the doctor checks your knee reflex. You don't even have to think. You hit it and it moves all by itself. Hiccups are the same way. It involves two structures and a couple of nerves. One is your brain, actually your brain stem way in the back, the primitive part of the brain, and it sends nerves down to your breathing muscle. Your breathing muscle, besides your chest wall, your lungs and that kind of thing, and the muscles of your ribs, they help you breathe, but there's your diaphragm. Your diaphragm is a big, kind of a half circle shaped dome muscle. It goes from front to the back and it's shaped like a dome, like this and like this. When it contracts, it goes like this. And when a dome contracts and flattens out, what does that do? It causes the cavity in the chest to get bigger, and that would pull air into your lungs. That's how you breathe, right? That dome constricts, pulls air into your lungs inflate, and then you breathe out. Or in, out. That's a terrible dome of your diaphragm. But your diaphragm muscle, that's what it does. The brain sends basically three types of nerves down to your diaphragm. One is the vagus nerve, one is the phrenic nerve, and one is the sympathetic nervous system. They're all interconnected, and that's how we breathe. It's kind of an interesting thing. You can choose to breathe. You can breathe on your own as fast or as slow as you want. You can hold your breath. Or when you're asleep, you don't even have to think about it. Or when you're awake and doing something else, you don't think about breathing. It just takes over automatically. It's kind of an interesting system, right? We can control it, or it will take over all by itself. You don't have to do anything. It's an autopilot, but you can override autopilot anytime you want. Well, what are hiccups? It's when you get kind of a little reflex and it makes the diaphragm spasm. It's kind of like a spasm of the diaphragm muscle, just like that twitch on your eye we talked about, twitching of your eye. Or what's another one? Every once in a while, you'll feel your muscle just kind of twitch a little bit, right? Well, when the brainstem sends a signal and the diaphragm goes like this, and suddenly air wants to jump down into your throat, into your lungs, your vocal cords, and you can Google vocal cords. They're these two little pieces of tissue. They're not very big, and everything that goes into your lungs has to pass through those vocal cords, okay? So air, of course, you breathe in, air goes in and out. Anything, if you aspirate and you get something in your lungs, it has to go through those vocal cords. And when you drown, water goes through those vocal cords and goes into your lungs. There was a thought that when you drown, you get water and they would spasm and nothing gets through. And of course, if nothing gets through, air can't get through. Hopefully the water doesn't get through. But if air doesn't get through, then you can drown. So anything that makes those things spasm suddenly, what's it going to do? And that's your voice. When you talk, those vocal cords, right? They're in your windpipe. They kind of do this. That's how you talk. And then your lips and your tongue form words and sounds, but it's your vocal cords, vibrating together. That starts the whole thing. So what happens if your diaphragm spasms and pulls air in? Right? They spasm and they cut. That's why it makes that sound. Okay. So those three nerves go from the brainstem down into the chest and go to that diaphragm. So anything from the brain down through the neck, past your heart and lungs, and down into your diaphragm. And so your heart and lungs are on top of the diaphragm. What's just below the diaphragm, next door neighbor to your heart and lungs? Your stomach, your intestines, your pancreas, all your internal organs, right? So anything that's wrong between here, your neck, and there can cause hiccups or irritate those nerves, just like when somebody hits your reflex and it makes your knee kick, right? You don't have to think about it. It will do it all by itself. And we know because we hate it, right? And it's annoying. We don't like that feeling. 99.999 out of 100 are going to be nothing. It's going to just be a spasm. It's annoying. Something irritated the nerve. It could be your stomach got stretched from a big meal. Have you ever noticed sometimes when you eat a really big meal or you drink a soda pop and it expands your stomach gets stretched really quickly, or it just gets stretched because you ate a big meal? Or sometimes we don't even know why. Sometimes just out of the blue, you get hiccups and it makes that spasm. So a big meal, something like that, most of the time it's just something minor and annoying. But if it's something serious, something in the brain, like an infection, meningitis, encephalitis, a tumor, an abscess, an infection in the brain, or something in the neck, you can have a tonsil infection or an abscess in your neck, or a stroke could cause it. I've never seen this, but I've heard foreign bodies in your ear can trigger the fake vagus nerve and irritate that phrenic nerve. And when the phrenic nerve spasms, it makes you get a hiccup. And then anything down into your chest cavity, pneumonia or an infection in your lungs, a heart attack or pericarditis, the inflammation of the sac that your heart beats in. Your heart beats inside of a sac. If you get irritation in that sac or a heart attack, that can cause hiccups. Lung cancer, and then anything below the diaphragm. So bowel obstruction, gastritis, hepatitis, pancreatitis, anything from the head through the neck into the chest, heart, lungs, anything on the other side of the diaphragm, your intestines, stomach, anything like that can cause hiccups. Now, here's the key. Anything hiccups that last a day or two or three, not a big deal. Those are just hiccups, right? We hate them. We hope they'll stop. And maybe we'll talk about a couple of ways to try and stop them. Good luck. There's a million ways. That shows you that no one way works because there's so many possible ways. But anyway, anything that irritates that is going to make it come all by itself. But the hiccups that typically you get will last, minutes, hours, maybe, hopefully not hours. Days would be unusual. I've seen a few patients in clinic. These don't come to the ER, maybe urgent care, but I've seen many in my clinic over the years, and they had hiccups that lasted. Once they go about 3 or 4 days, people start getting concerned, like, why is this going on? It can just be a cold or a sore throat or something irritating, a virus, a cold that you got could cause it. It's nothing worrisome. It'll go away on its own. Just like a rash that you get on your arm goes away eventually from a cold, the hiccup will go away when that nerve irritation cools down. So, but if you have hiccups that go on, the books will say something like refractory hiccups for 30 days, a month. Can you imagine? Nobody's going to wait a month before you go in for hiccups. If you have hiccups that go on for more than about 5 or 6 days, getting up to a week, you want to go in and be seen. What are they going to do? They're going to check first of all, here's another clue. Do you feel okay, right? If all you have is hiccups, you're almost surely going to be just fine. I've never had a patient die of hiccups. But again, those problems in your brain or your neck or your throat or the chest or abdomen that causes hiccups, that's what's going to get your attention. It's not the hiccups. That's a secondary concern. The first thing is, man, I've got this headache. Man, I've got this fever and a headache. Oh, I've got this chest pain and these hiccups started. Or I've got this abdominal pain and I've got a fever and now I've got hiccups. You'll have some other symptom. If you have some major problem in your brain or in your neck or in your chest or abdomen and you get hiccups that don't stop, I think you'd know you need to go in. But if all you have is hiccups, give it a few days, give it some time, and you'll know if you need to go in. And what they'll do, if they've been going on for a week or more, they'll probably do a couple of blood tests, check your electrolytes, make sure that your sodium and potassium are not off. That can trigger hiccups if you're off on your electrolytes. They may want to do a chest x-ray and just make sure there's nothing weird in your chest, a growth or a tumor or a cavitary space in the upper lungs. Maybe if you don't have any neurologic symptoms, they probably wouldn't do a CAT scan in the first week, but by the 3rd or 4th week, they're going to start doing CAT scans and MRIs to look if you have some mass in there causing these hiccups, right? So anything from an x-ray of your head, X-ray of your neck, your chest, blood work. That's the things they're going to look at. And they're going to do a full physical and look in your throat, look in your eyes, look in your ears, and see if we can figure out the reason you're irritating these three nerves, the vagus, the phrenic, and the sympathetic nerves, that you're getting these spasms and causing hiccups. Most hiccups, I've never seen one that was worrisome. I had one patient. We couldn't figure it out. We did the CAT scans. We did every X-ray, blood test. Nothing was wrong. We couldn't get his hiccups to stop. He had them for over a year. And the poor guy, there's all kinds of medicines you can try. We tried them. Nothing worked. Now, as far as stopping hiccups, it's a spasm of your breathing muscle. So if you can kind of take control of your breathing muscle, remember, you can control your breath. So people talk about drinking cold water. The cold will stimulate your vagus nerve at the back of your throat. And while you're drinking water, you can't breathe. Hopefully, you're not even trying to. You don't want to breathe while you're drinking water. You don't want water to go down your lungs. So you kind of have to hold your breath. So take a cold glass, very cold ice water, and drink really, really slowly over about 60 seconds. And your diaphragm muscle can't breathe while you're drinking. And sometimes if you can just hold your breath or kind of control your breathing for a minute, the spasms will stop. I've seen that. Another one people say is breathe in and out 10 times. 9, 10, then take a breath and hold it and push. And believe it or not, that triggers the vagus nerve, the one that's irritated maybe, and can stop hiccups. If you try the cold water, hold your breath for a minute, drink over a minute, and you do the hold your breath and push and it doesn't work, then your guess is as good as mine. Google it. YouTube it. I'm sure there's a million ways to solve it. So anyway, that was a light, happier, funner topic. It's rare. I've never seen a case that's worrisome. I've seen many cases. They always go away on their own. There's some medicine your doctor can give you if they're going on for 4 or 5 days that can help you get rid of them. And if you don't have a headache or neck pain or chest pain or abdominal pain or a fever or any kind of neurologic, I can't see, I can't move this hand or leg, or I can't speak. If you don't have any of those, hiccups are never anything to worry about. And that's the truth answer on that. Okay, hopefully that was interesting and gave you something that you now know, and it'll help you. Okay, see you next time. Bye-bye.